Dr. Brian Klym talks about the Kodak 90003D dental scanner. The Kodak 9000 and how you're able to achieve more with the system involved, with the implant.
Well, I'm able to measure and make sure there's enough bone, and so I can plan a lot better. Without me working with it, it's like working without a level or a tape measure, so I'm just guessing. But with that Kodak 9000, it allows me to get accurate details, and I've always believed it's better to measure twice and cut once, than, especially when it comes to this type of stuff. It takes the guesswork out of it.
The Kodak 9000. A segment from Northwood Dental, northwooddentaltc.com. Dr. Brian Klym of Traverse City.
The surgery was based on the surgeon's experience, and you're guessing. This takes the guesswork out of it. You know that you have X amount of bone, and you know how far away the nerve is because you're able to measure it. And I don't have to worry, am I getting close to the nerve? Because I know, no, I have 14 millimeters to the nerve, so I'm going to use a 12 millimeter implant. So it's just, I know when I'm getting. Once I've done the diagnostic work, I know what's in store for me in the surgery. I know how much bone I have to work with. I know if I have to add bone. I know if I have to expand bone. I know if I have to raise the floor of the sinus. And so I'm prepared for it, and I'm ready, and I know I have a plan of action when I go into the surgery, and so the surgeries are a lot shorter.
Lower radiation, we have the precision. Project out a scenario of a patient. This is how it would have been. Now we don't see it. And
I guess what we've seen in the past is that we were going to take a CAT scan before. We would send the patient to the hospital, and the CAT scan would be around $1,000 for the image. We'd get the images back from the hospital, and I wouldn't be able to manipulate them because I wouldn't have the software to sit down and work on it. I would get like a two-dimensional picture. With my computer, I can move the thing around like a three-dimensional object. I can look at it, I can pick my own slices, and plus they would have to leave the office to go have this done. Here's the comparison of medical spiral scanners to the cone beam. What we have is a cone beam.
Okay.
The scanning time in the hospital was 10 minutes.
Okay.
Ours is approximately 30 seconds.
Dr. Brian Klym of Traverse City.
In the hospital was 10 minutes.
The Kodak 9000.
Approximately 30 seconds.
NorthwoodDentaltc.com. Dr. Brian Klym of Traverse City talks about the Kodak 9000 3D dental scanner.
We can use it to check for any sort of pathology in the maxillary sinuses, with even the possibility of using it to check airway for sleep apnea. Myself, I had a tooth that I've had a root canal on. It's been bothering me. I took a scan of it, and I have had an underlying sinus infection at the time that I wasn't aware of. I was able to tell exactly which canal was infected. It was the mesial root, but it's close to the sinus.
Dr. Brian Klym of Traverse City.
I'm not stopping to take a bunch of x-rays along the way. I may still stop and take x-rays, but I am a lot more confident.
The Kodak 9000 dental scanner. NorthwoodDentaltc.com.